Today we're going to be doing a head and neck treatment. So the first thing I'm going to do is get Leah to take a nice big deep breath in for me. Good. And slowly out. Good. And then I'm just going to start on your chest by the collarbones and slowly bring my hands around. We're spreading the oil. So I'm starting on the pecs and then bringing it around to the shoulders, up around the traps, back of the neck, some spleen cap, up to the occipitals. Checking pressure, seeing how we're doing. Just good. We could feel that its end of her pec is really tight right into the attachment into the shoulder here. So we're just doing a little bit of work in through there. I find that oftentimes when the pecs are really tight, people will get shoulders that are pulled forward a bit. Bring my hands up to the back of her neck again, working in a long spleen cap. And come back down into the trap. Your upper trap connects at the top of your shoulder blade and comes all the way back into the back of your head in here. And then another muscle called the levator scapula. And it connects from your C1 to your C4 down to top of the shoulder blade. And it kind of goes right below your upper traps, and it can get really tight, especially when people have a head forward posture. And I find a lot of people that work at desks or any kind of job where they're moving their shoulders and neck a lot, it can get really, really tight on people. And a lot of people will complain of upper trap pain when it's more than likely not, sometimes levator scapula. Or left scap for short. Coming back into that trap, we're just going to be picking up a little bit. I'm doing okay for pressure. I'm gonna do a little bit of the pin and stretch on her trap. So not that all ranges of motion for the trap, but I am gonna do the lateral flexion for it. So a little bit of pressure, moving her head to the side. And down a little bit more on the scalenes, a little bit on the SCM, or sternocleidomastoid, but not a lot, just because Leah doesn't like it. So with the scalenes, there's 3 different scalenes. You got your anterior, middle, and posterior scalenes. Now, these guys can get really tight when you're apically breathing. Apically breathing meaning as like breathing through your chest, less through your stomach. Or a lot of people find they get really tight when you're stressed out. Again, they can kind of cause headaches. They can cause referral pain into the front of your chest or down your arm. These are pretty thin muscles in general. Thin muscles that can cause quite a bit of discomfort for some people. And then you have SCM, or sternocleidomastoid. So it connects up into like the back of your jaw, ear area, and then all the way down to the front of your clavicle or collarbone. Now with this one, you gotta be careful because there is an artery that works right by it. You just want to be gentle. A lot of people are really sensitive on the front of their neck. It can cause a little bit of anxiety sometimes, so you just want to check in with the person before you go and do any treatment on the front of their neck. But this muscle is oftentimes a huge cause of headaches. It refers to two places, right? Either in behind your eye or the top of your forehead. And a lot of times when people come in for headache treatment or anything like that, I'll be like, hey, are you okay if we work on the front of your neck? And just kind of explain to them the pros of working on the SCM and trying to get them that relief. So I'm just working into the back of the suboccipitals. Again, that kind of like head forward posture. People looking at desks all day long can put a lot of pressure back here. A lot of people will feel a lot of pressure at the base of their skull. And making sure you're heading in a little bit inner, but as well as a little bit more on the outer portion too. So normally do that on both sides. And then I'm getting into her head, temporalis. So temporalis is also a jaw muscle. So when people clench their teeth, grind at night, this guy can get super tight. So just working in through there. You want to work all through the connecting points. So it's basically the whole side of her head, and it connects in through just through the top of her ear, like not into the ear, but connects just above it. So I find that a lot of people get some trigger points in through here, which she has. You just kind of hold them. They're really tiny. They can and then take anywhere from like 15 seconds to maybe 60 seconds to release. And then you move on to the next one. Nice little finisher. Still a little bit on the forehead, a little bit on the face. Just a nice way to kind of finish off the massage relaxed. One really nice one that I like to do is a little picking up of the eyebrows. You don't realize how nice it is until you get it done and you're like, oh, that feels really good. Because there is a little muscle right underneath, and it's not touched. It's just stressed with facial expressions. I've done everything on her right side, so of course I would do everything on the left side as well, kind of in unison. So just make sure you do it all on both sides.